In recent years, conversations of racism and prejudice in healthcare have become more mainstream, from Black people not being taken seriously when it comes to pain, to Black women having the highest maternal mortality rate in the United States. It's left many patients questioning, would I have received this treatment if I wasn't Black? And some medical professionals are working to find out just how deep the prejudices may go. Dr. Uché Blackstock has not only studied these issues, but has advocated and demanded change in the healthcare system. Her book, Legacy, A Black Physician Reckons with Racism in Medicine, dives into her career in medicine and the disparities in healthcare. And Dr. Blackstock, kind enough to join us in studio today. Welcome to the show. Thank you so much for coming by. Just want to get into the idea. I didn't realize only 2% of medical doctors are Black women, and the significance of your mom. She's a doctor, pass it along, you and your twin sister. It's the first mother-daughter legacy to graduate from Harvard Medical School. How did she influence you to decide you too wanted to become a doctor? And not just you, but also your twin sister.
Yes, well, thank you so much for having me here today. Well, you know, my mother was she was our role model. And essentially, I grew up thinking that most physicians were Black women. I had my mother who returned to the community that she grew up in central Brooklyn to take care of her neighbors and family. And then I also had other Black women physicians. My pediatrician was a Black woman. So I actually grew up thinking that most physicians were Black women. And then I entered college and I was pre-med and I saw the statistics and said, wow, we actually are the unicorns. This is actually a rarity.
And we've heard a lot, at least anecdotally, about the systemic inequalities in the healthcare system. But what made you want to take a deeper dive into it and then write a book about it? Yeah,
well, I think, you know, having a mother who was a physician, understanding that our numbers were so low, and then looking at the history as to why. You know, there were practices and policies that were put into place in the early 1900s that closed historically Black medical schools and actually have led to between 25,000 and 35,000 Black physicians essentially being erased. They would have been educated by those medical schools. So it really was my own journey from medical student to practicing physician to seeing what my patients were going through that made me want to delve deeper into the history to figure out why, as you mentioned, Black mothers are 3 to 4 times more likely to die of pregnancy-related complications, to recognize that there's nothing inherently wrong with Black Americans, but it's the system, the legacy of slavery, Jim Crow, systemic racism that has led to these health inequities that we see today.
And you point out that it's not just unconscious bias, but in some cases, it's actually taught that, for example, Black bodies are different from white bodies.
Yeah, like, you know, so we were taught both implicitly and explicitly in medical school that there are differences in kidney function, for example, between Black patients and non-Black patients because of myths that Black people had higher muscle mass, and that correlated with kidney function. And essentially what that has led to is that has led to Black patients not receiving the specialized kidney care that they needed, not being placed on kidney transplant lists. So those beliefs, or those myths about Black people being biologically different than other people has actually led to us being harmed and worsening health outcomes.
What kind of personal experiences have you observed with regard to these kinds of inequities within your own experience?
Yeah, I mean, you know, when I think about my own experience as a medical student, I had appendicitis and I went to the ER 3 times as a medical student. I was misdiagnosed. There was a delayed diagnosis. I ended up rupturing my appendix. And during that whole process, I really was questioned as to how much pain are you really in? Like, what is your past medical history? Some of my complaints and concerns were minimized.
What can people do once you're equipped with the knowledge, right, and you are aware of the statistics and the disparities? How can you change the outcomes?
Yeah, so we need medical schools to educate our students to be able to care for a racially diverse patient population. We shouldn't just leave it up to Black physicians to do that. Everyone should be able to care for patients in the most equitable way. So looking at our curriculum and seeing how patients are medical students are taught, but also holding hospitals and healthcare institutions accountable. So, you know, making sure that they're keeping track of metrics, keeping track of patient feedback, and intervening when needed. And then expecting our policymakers to look at policies that reinvest in Black communities.
Dr. Uché Blackstock, we thank you so much for your time and insight. Want to let our viewers know that her book, Legacy, A Black Physician Reckons with Racism in Medicine, is now available wherever books are sold.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.